you here. Please say hello and where you're from. And yeah, if you've got those questions from yesterday's show, let me know what they are. Put them in the comment section and I will do my best to answer them. Always remembering, of course, to ask sort of a generalized question makes it easier for me to really respond. And it's great to have you here. David, nice to have you here. Thank you, Liz Q. 702 is in the house. Great to have you here. Thanks for tuning in today. And Elsie Castles, hello, hello. Lizbeth as well. Eworm. Dhruv Gupta, hello in India. Nice to have you here. Is it Melradom in BC? Great to have you here. Sean? Is it Shan? Rennick in Oregon. Nice to have you here. Thanks for tuning in. ENJ Hawk in California. Tony Zem in New Jersey. Bev Gill, hello, hello. Victor Reynolds in Wichita, Kansas, hello. Great to have you here. And is it Adagabe, did I say that right, in Nigeria? Thank you for tuning in today. Ladu in Tampa, Florida, I'm guessing. Great to have you here. Thank you so much for tuning in. Griselda in Escondido, California. Thanks for tuning in. So if you were here yesterday, of course, we had the Doctor Janine Show and we went through a bunch of topics yesterday. We talked about lymphatic drainage and moving the body, jump training. We also talked about chronic kidney disease yesterday and I gave you my tips for that. We also talked about some of the good and the bad about berberine. So I know a lot of people consider taking or are taking or have taken berberine as a supplement. It was very popular, I'm going to say, probably 3 years ago or so, and was in the news a lot about balancing blood glucose levels, but there are some caveats to berberine, which we went through yesterday. So if there's anything that you want me to review from yesterday's show, let me know as well. And of course, if you do have questions, please put them in the comment section. Temba World in Kenya, thank you for tuning in today. And Zen Mabulu in South Africa, Zenil in South Africa, thanks for tuning in. It's great to have you here. And Ms. Bev R from MR. Where's MR? That's a bit of it. Oh, Maryland. Yes, thank you so much. Yeah, great. I need the help sometimes with the U.S. states. Maryland and Sarajni in San Francisco. Thank you for tuning in today. It's great to have you here. Okay, so Bev, you want me to go through some of what we talked about with berberine? Yeah, let's do that now because yeah, you have to be. I mean, with any herbal medicine or anything that you're ingesting, really, or anything you're putting on your skin at that. You know, which is important as well. Things that we talk about is, you know, of course, decreasing your toxic load on your surfaces. But when you're ingesting supplements, you have to be really aware as to what you're actually ingesting, making sure there's no other added fillers and flow agents, which is something I talk a lot about. But when we talk about berberine, let's take a look really quickly at, you know, some of the drawbacks maybe of berberine and some of the things that you have to be aware of. So berberine, of course, comes in all different formats. Usually it could be on its own in a capsule format, but it could also be, you know, mixed with other herbal ingredients. But some of the side effects of that berberine include gastrointestinal issues. So you could have nausea and vomiting, abdominal pain, bloating, constipation, diarrhea, and it tastes very bitter, the berberine. So it does have a number of interactions with other medications as well. So that could be something that is, you know, if you are taking pharmaceuticals, then berberine in a lot of cases is not going to be indicated. It will be contraindicated. And it is contraindicated, unsafe in pregnancy and breastfeeding. So those are really, really important points. And the other thing that I mentioned, they did a study actually on the efficacy of berberine supplements, and I don't know if we can pull that up really quickly, but they found that a huge percentage, I think it was 60% of the tested berberine supplements actually failed to meet the potency standards of what a typical pharmaceutical in terms of pharmaceutical preparations in the US. So 60%, 9 of the 15 tested products failed the potency. So again, when you are taking anything internally, especially supplements, you really have to entrust in the brand that you are taking, and that's really important. So more questions about Yeah, so the Genesis, I just went through some of the side effects. Estelle, thank you for sharing today's live. It's great to have you here today. And C. Griffin, I'm so glad. Thank you for tuning in. And okay, so the berberine is typically used as something to balance blood glucose levels. It's used for weight loss. That's why it became so popularized in terms of helping with weight loss. All right. Okay, Emma Jane Floyd is asking, is NMN good to take? There are questionable safety concerns with those types of supplements, so you might want to sort of look that up. I'm not a big fan, personally, for NMN and some of the higher dose niacin types of supplements because they can enhance cellular growth and turnover, and most times, all of the supplements that I've seen, they're not from food. And I'm all about taking, and I do, usually talk about taking whole food supplements from, plants, from natural sources. I don't like the synthetic vitamins and NMN and the NAD pluses, and all of those are synthetically made. So it's not something that is part of what I would suggest to people. Maplock is asking, can magnesium glycinate sometimes exacerbate anxiety symptoms? It's possible. I mean, everybody reacts differently to different supplements. It's not something that I've commonly heard. Again, if you're taking magnesium, I do prefer a bisglycinate. So it has the two molecules of the glycine, and making sure it doesn't have any of the fillers or the flow agents. And here's the thing about, taking vitamins in general is that often they're going to have things like magnesium stearate, which is not magnesium. It's a flow agent that they use and does have side effects. Other fillers like microcrystalline cellulose, silicon dioxide, titanium dioxide. So the question is, okay, is it the actual magnesium that you're taking in your magnesium glycinate that's causing the symptoms, or is it some of the added fillers and flow agents in your formula that could be part of the problem? So it's something to definitely investigate. You always want to take supplements, if you are taking supplements, without the fillers and the flow agents is the best way to go. So you're getting, the efficacy of those raw materials that you're looking to feel better with, but at the same time, you don't have to detoxify those extra fillers and things. Okay, Phenomenal has a great question. Melatonin supplements and caffeine. If you tuned in, so maybe you missed yesterday's show, I did talk about melatonin and its effects for kidney disease. So melatonin, the molecule itself, has been studied, and in that study, and I said there was a caveat to the study, maybe we can pull it up really quickly in terms of kidney disease. But the caveat is that I don't think that anybody should be taking melatonin as a supplement. And if you're new here, please put a 1 in the comments if you're new here. I want to see all my new people. But also, check out my posts on melatonin. So just look up my name on social media, whichever platform that you're on, look up my name and melatonin supplements. There are some, drawbacks to taking melatonin as a supplement. I've never recommended it to any of my patients, and I've been in natural medicine for close to, I'm going to say, 27 years now? Never recommended it once. I've never taken it myself. I'm super concerned about taking it as a supplement. It's a hormone, and it's always synthetically derived. So melatonin can be helpful, though. So here's the caveats. In the study, it showed that it can be helpful in every type of kidney injury caused by inflammation, apoptosis, oxidative stress, regardless of the mechanism. So we know that melatonin itself as a molecule can be helpful for our health. It's a master antioxidant, really, really important to help to clear up bad cells as we're sleeping, because it is the hormone of darkness. That's when we naturally secrete it. But that's my whole point. You want to increase your own endogenous melatonin by having the proper sleep-wake cycle, by following your circadian biology, by getting natural sunlight exposure, especially first thing in the morning as the sun is rising. That's when you start to manufacture that melatonin for release during sleep at nighttime. And this is where people are getting it wrong. You're under artificial lights a lot. I mean, there's a lot of problems related to your circadian biology being out of balance with nature. So that's where you start. When you want to improve your melatonin, is do it naturally, whether it's for kidney disease or anything else. You want to do it naturally. You don't want to take it as a supplement. L-tryptophan phenomenal is asking for sleep. Yes, for some people it works, but again, as a precursor to melatonin, again, taking the building blocks of a molecule is not the same as in having that endogenous release of your own melatonin by making your melatonin. Yes, you do need the building blocks, but maybe your circadian biology, which it is for a lot of people, is completely off kilter. And that's why, let's go back over here. At nighttime, one of the things you can do is, make sure that you're turning the lights off. If you need to have lights on or a screen, that you are wearing your blue light blocking glasses. This becomes really, really important to block that blue light, especially at night. There's a lot of research coming out right now on artificial light at night and why you have to block it, especially from your eyes, but also your skin. So I actually cover up whether I'm under a blanket, if I'm watching a screen for a little bit, or, whatever clothing I have, I try to cover up my skin as much as possible after it has become dark naturally from the sun setting. Shilajit, yeah, I think Shilajit is great. You just have to make sure you're finding a pure form of it. And inositol, I don't always like Ray Nierva Jr. in Canada, I'm guessing, because it's synthetically derived. So you want to look for your B vitamins from and anything that is like inositol and phosphatidylcholine. You want to get those from natural food sources whenever you can. So that is something that you can investigate more on. And nerve pain. Okay, so that could be related. And you also, Shan, you also have a question about veins. So I do have a combination of herbal medicines that I love for helping the veins and circulation. And I don't know if we have a slide of that one. Maybe we do not. I don't think we do. Maybe that's something we could actually feature in a future show. We'll make a note that I'm going to do some vein building and strengthening our vein protocol. I'm going to show you my protocol. We'll do that in a future show. There are some great herbal medicines that help to do that. So that's something that we can work on. Nerve pain. One of the things you have to discover if you have a B12 deficiency is often related to nerve pain. And a lot of people are low in B12, even if your blood work. I looked at some research actually today on vitamin B12, and the research is saying in terms of as we're aging and cognitive decline, they did a study that found that even if blood work is in the normal range for the aging population, that it's simply not enough to help to displace the loss of cognition with aging. So that was interesting. But with nerve pain, it's the first nutrient that I think of is B12, but also your omega-3, so your DHA and your EPA. And, sunlight exposure, of course, is like top of the list, so important, which so many people stay out of the sun because we've been taught to fear the sun, that it's so damaging, but the opposite is actually true. So we want to make sure that we are getting enough natural sunlight exposure in a safe way, of course, and that's all in my new book, and I have tips and tricks on how to do that. And welcome, Brian. I guess Brian is here, and maybe for the first time, nice to see you here. Thank you to everybody who subscribed today, and for those of you who shared today's live as well. Great to have you here. All right. More questions. Anything about yesterday's show? Latent nerve pain. And some people can't process B12 because of methylation issues. That's why you want to look for an adenylyl cobalamin, which is the type of B12 that is readily absorbed. That's the type that is naturally found in beef liver. But you can take it in supplement form, like in a whole food complex. Chlorella is another natural source for B12, so that's the way that I took it. I took mine this morning. The adenylyl cobalamin, which is complex with the chlorella. And I like to take it in the morning because it gives you energy for the day. It helps with your metabolism of your carbs, your fats, and your proteins. And helps to wake you up for the day. So that's why I prefer it in the morning. Yeah, another question? Yep. Sugar cravings. Oh, yes. Where do we start with sugar cravings? Well, fixing your leptin signaling, really important. If you don't know what leptin resistance is, please check out my videos about that. Sugar cravings, of course, you've got to sort of, I'm not saying to go off carbs completely, but sort of watch your carbs, especially, the processed carbs. That's the first thing that should go. Natural carbs from fruits and vegetables, probably okay. But the timing of your carbs matters in your meals as well, which is something that I've talked about. So try to eat your carbs last and have your proteins and your healthy fats first, your fiber, and then your carbs last. Not eating after dark is one of the things that can fix your leptin signaling and your insulin signaling and your insulin resistance as well. And it's usually the leptin problem and that's why I say start with the leptin, learn about leptin resistance first before you start to have an insulin resistance problem, which a lot of people, you focus on the insulin resistance, or the doctors focus on insulin resistance, where, taking into account your circadian rhythms and your leptin signaling and how your brain chemistry works with your environment and the light signals of the day and the dark, that becomes, all part and parcel as to how your hormones are working together. Lisa, give me a breakdown. I've been asked this question before, a breakdown of the supplements that I take. That would be something interesting for a segment in a show. And it's changeable. I mean, depends on the day and what season it is. But I could maybe put that together in a show. That would be fun and alive to go through that. Thank you, Orlando, for sharing today's live. Amazing. Some of the things, that are my dailies are omega-3 fatty acids, higher in the DHA. I also take something to support my thyroid. I take some herbal medicines to support my hormones. And I also love my eye formula with lutein and zeaxanthin and some herbal medicines that really support the eyes. B12, for instance, I took this morning, depending on the season and my moods and things, vitamin D3. I mean, I've got a lot of supplements at home. And, depending on, and if I'm fighting something, then of course my organic vitamin C, which is a whole food vitamin C. And of course I always take whole food vitamins. So not, synthetic vitamins. All of my vitamins are whole food based from, fruits, vegetables, plants, herbal medicines, and things like that, if that makes sense. Okay, is this Florida Lisa, maybe? FLA Lisa. Okay, so you're vitamin D deficient, but you can't stay out in the sun too long because you burn too fast. We'll stay in the shade. Work up and depending on your skin tone, this is something that I share in my new book coming out, so you can learn about that in my new book called The Lost Medicine, and we'll show you what it looks like in just a second. But yeah, so you want to sort of build up your base for building up your melanin depending on your skin tone. Like I have very fair skin, but if I build it up slowly, I can get very, very tanned. I may be different than you, it depends, and I stay in the shade a lot, but you are still getting that vitamin D, even not from being in direct sunlight. Even on a cloudy day, you can still make your vitamin D. And depends where you live too, right, and the time of year. So you can check usually on your weather app on your phone, or there's other apps like the Circadian app that you just check, how much UVB is coming through, what time of day can you maximize that UVB exposure, and just make as much from your skin as possible. Some people do need to supplement. And skin health supplements, yeah, I mean, combinations, L-lysine is a great thing, silica from horsetail herb, in combination, collagen, a grass-fed collagen is great for your skin as well. As we know, the omega-3s, that's one of, my beauty goes to is taking the omega-3s and eating, fish and seafood in the diet as well, which is great. I hope that helps. Yeah, so many great questions today. Helga, best suntan lotion, a natural one that you make yourself. I do have that recipe, so you can check that out on my social media platforms, and you can definitely find that. If we could, yes. What do I recommend taking instead of berberine? Okay, that's a great question. So I prefer sort of a different combination of herbal medicines that is great for balancing blood glucose levels, at the same time doesn't have, some of the negative side effects that and I don't know if we have those on screen, do we? Can we find those, the combo? Anyways, yeah, so we're going to maybe work on that for a second. But yeah, so making sure that we're balancing our blood sugar levels and without having to do it with the berberine and having those GLP-1 agonist types of effects. So the injections that people, I'm saying everybody, but not everybody, a lot of the celebrities are taking those injections once a week, or people are even microdosing the GLP-1 agonists now, and for weight loss. But again, there's negative side effects. So if you can do that from a natural herbal perspective, then why not? And fiber helps to do that as well. Balances your blood glucose levels as well. So I don't know if we can pull up the list of the herbs. Yes, okay. Oh, we do. Okay, here we go. So this is what I use in lieu of berberine to help to balance blood glucose levels. And I don't use it every day. Personally, I use it on the days kind of when I cheat. I overdo it with carbs. We're at a birthday party, whatever. I've had a little bit more refined carbohydrates. I do allow myself treats. I'm not one of those people who I get totally abstain from all the bad food all the time. No, I live what I would like to think is normal life, and I enjoy my treats once in a while too, but this is where I love the fact that I can use these herbal medicines, and these are all in combination together. Muscadine grape skin, the African wild mango seed, gymnema, and the white mulberry. I take that in combination together to help with balancing blood sugar, because I can feel it now. I mean, as a kid, we don't really feel our blood glucose spikes. Some kids are more sensitive than others, but now as an adult, I can really feel it if I overdo it with sugar. And it's something that, it's great to have Mother Nature that helps us with the herbal, medicines to be able to balance blood glucose levels. Helga, recommendations for osteoporosis? Yeah, I've got a bunch. So vitamin K2, a whole food calcium, magnesium, vitamin D3. So maximizing that quad. Those are the 4, which is so important. And keeping your bones healthy and limber, and with that proper lubrication is important as well. So movement and mobility training, really important. Okay, more questions. Sorry, I'm so overwhelmed. They're all coming in at the same time, which is amazing. 5 tips for joint pain relief. Okay, so these are some of the things that we talked about yesterday. I know that let's review it really quickly. Should we do that? Yeah, okay, so here we go. So some of the things that you probably haven't heard about, if you do have those stiff and achy joints, is reduce your EMF exposure, sleep in a dark room, and because that is going to affect your circadian biology. And for a lot of inflammation happening in the body, it has to do with EMFs. So electromagnetic fields, what is that? That's your cell phone. That's anything that's plugged in, your Wi-Fi router. Is negatively impacting how your cells are actually functioning, increasing your inflammatory response, and making you sore and achy and miserable all the time. So whatever you can do, and I've got a bunch of videos that you can check out as to, tips how to reduce your EMF exposure. It's actually in my new book as well, which is here. I promised I would show it to you. I've got a bunch of tips in my new book that share exactly how to lower your EMF exposure. It's called The Lost Medicine. You can check it out. And it will be shipped. There we go. You can go to the website. So it's still on pre-order for the actual physical copies, but on Amazon now you can get the Audible version of it. So yeah, so check it out. The Lost Medicine. There you go. And yeah, a ton of tips as to how to reduce EMFs. I talk about sunlight exposure. I talk about beauty tips. There's a lot in this and my latest book. It's my 3rd book that I've written. And the first 2 were national bestsellers, which I was so proud about. But yeah, it is great that it is almost finally here in its physical form, which is amazing. Okay, so going back to the list now really quickly about the joint pain. So reducing your EMFs, we talked about that. Stay active with low impact movement. So as much as you are in pain, you do need to move, which can be very difficult. If you've got, painful and sore joints, you do need to move, which is important. Take a high quality turmeric supplement, which has an added curcumin. That's the type that I take, and it is fantastic. It's a game changer, not only as an anti-inflammatory, but a powerful, powerful painkiller effect as well. The analgesic effects, remarkable for taking turmeric plus the curcumin together. Try castor oil packs, which is great for achy joints, and that's something that I demonstrated yesterday, how to do that castor oil pack. And you can use that magnesium bisglycinate, and that helps to relax the muscles, because often if you've got joint issues, there are tight muscles that go around that area, and it is important to be able to do it naturally. All right. Powerlifting, yeah, phenomenal. Powerlifting and HIIT training, also great, depending what age and stage you are at. Yeah. Okay, back pain and the person's in your 20s? Yeah. So some of the supplements, I like a good joint combination, like a whole food formulation for joint pain that has your glucosamine sulfate, chondroitin sulfate, boswellia, which is frankincense, and the studies on frankincense, amazing for joint pain. You actually have to feed the joints with the nutrients that they need, and that's why that combination can be really helpful in terms of being able to make sure that you are getting out of pain, number one, but also, actually feeding the joints with the nutrition that they need and often there's a chronic inflammatory response, so lack of grounding. So just taking off your socks and shoes, getting outside, getting grounded, and pulling up the Earth's electrons, which are very anti-inflammatory, and that's what the research shows as well. All right, well, thank you so much to everybody who tuned in today. Vivray, natural remedy to get away from gout. Yeah, so gout is a chronic, usually kidney issue. So and what I used to do with my patients is a full body detox with and containing some herbal medicines. Maybe we can pull that up. That helps with specifically the kidneys, and that proved remarkable in terms of being able to deal with gout and the pain of gout. There is some research for turmeric with an active curcumin as well for gout pain, but more sunlight exposure is huge for gout, which nobody ever talks about. But you got to get out in the sun and build up your tan, build up your melanin, which is going to be a powerful antioxidant. So your suntan, or the darkness in your skin from your melanin, is a powerful antioxidant. So that's important as well. All right. More questions coming. Okay, I'm going to try to get to those ones. Okay, so this is the list of the detox herbs for that full body detox, specifically for your kidneys. Milk thistle is very restorative, regenerative to your kidneys. Horsetail, Equisetum arvense it's called, is naturally going to give you the nutrients to help to support your kidney health. It's a bit of a diuretic as well, as is parsley, so helps to sort of flush the kidneys. Bearberry, also great for your kidney health and can help with the gout and the gout pain. Yes. Okay. So there was a question that bromelain. Yeah. So bromelain, Bev, is a fantastic nutrient, and it's usually from not the outer fruit part of your pineapple, the inner sort of the white part, the core in the center of your pineapple when you're cutting your pineapple slices. So usually the part that we don't eat, and you would have to eat a lot to get a high concentration of GDU, so gelatin digesting units. And the way that I like to sort of visualize this in a supplement that has extracted that bromelain from the pineapple, it is at a high GDU. And what that means, it can actually go in and work like little Pac-Man to digest those protein gunk that could be in the joints, and that's why it's remarkable as an anti-inflammatory. So love bromelain. It works really well and that's the way that I take it. It's in a high GDU. I think it's a 2500 GDU. And the joint supporting supplement with some of the other ingredients that I had mentioned before, like the glucosamine sulfate, the chondroitin sulfate, and some whole food vitamin from fruits and vegetables and superfoods as well. Do grounding mats and sheets really work? I get this question like at least once or twice a week. People texting me or asking me this on social media. Yes. Already in the show, I believe that they do work. It's just you have to be weary of what you're plugging into as your ground. So if there's not a lot of, like in the middle of a big metropolitan city where there's a lot of underground wiring and like bad signals under the ground in which, the electricity or I'm not an electrician, as you can tell. But where the electronics of your house are connected and the electricity of your house, it needs to be in the plugs, needs to be grounded. And if you're grounding into ground that isn't healthy, let's put it that way, then that might not be a good thing. So something that, definitely, if you're buying the grounding mats and sheets, test your plug to make sure that it's properly grounded. And at the same time, just have an awareness of, and you may need to experiment. Do you feel better? Do you feel worse? We have them in our home on our beds with the special sheets as well. And since the first night that we used them, have found them remarkable. And I think they're great. So, but again, it's something that you can experiment with yourself. I know that it is an investment most times. So you might want to start with a smaller grounding mat. That's how I started, with a smaller grounding mat, and I used it at the office or at the house, and would stand on it and just use it for small amounts of time, and really found that it was advantageous for me. And then that's when I advanced and purchased it for the beds with the sheets. Okay, tennis elbow. Lots of tricks for tennis elbow. Again, if it's a chronic thing, then working out the fascia is important, grounding is important, decreasing your overall inflammatory response in terms of your EMF exposure, getting proper sleep. Your body actually restores and regenerates and detoxes as you're sleeping, so prioritizing good sleep. And then locally, of course, if you need to use one of the bands, they do work. But with tennis elbow, it's interesting in terms of being able to have an anti-inflammatory effect with some of the topical things that you can do as well. So the castor oil pack, maybe we'll go over here real quick, because we talked about this yesterday. I gave the example of a knee joint yesterday. So basically just taking some castor oil, and I'll unwrap this really quickly. If I can, it will come off. So taking some castor oil and putting that on a cloth. Make sure that your cloth, remember, with your castor oil packs, is going to, and this actually applies to calcific tendonitis as well. Would apply to the question coming in about that. So you're going to soak your cloth, whatever it may be, with some organic castor oil, hexane-free castor oil. Make sure that this cloth has been washed in only natural detergents, because you don't want, castor oil penetrates deeply into the skin, into the body. That's why it's so helpful. But you don't want to use something that has a lot of chemicals on it, like from your regular laundry detergent, fabric softeners and things, to be penetrated into your skin. So just make sure that you're washing. I do have my own detergent recipe. I think we're going to talk about that in my next live show. We're going to revisit that, so you can see the recipe. You can search it up as well. All right, so you're going to soak your cloth, and then basically you wrap. So for tennis elbow, what I also do is I'll put like even a bit of castor oil right on the skin, then the pack on top of that, and then you can wrap it. This is just the K-tape. Would be a great thing to use. This is handy to have in the house if you want to do some of the face taping techniques that I share for beauty as well. If you're new here, welcome on in. So you can check that out on my channels as well. It's not a great job, but anyways, you can get the idea. And then you want to use, if you want to, you can use some heat. So I prefer a hot water bottle, or at home we have one of those far infrared kind of pad things, and that can be something that's helpful as well. So there you go, and you can wrap that up, and you want to leave it on with castor oil packs at least 45 minutes so that it really has that deep penetrating effect after the 45 minutes, and it's great. So some people like to sleep with it on as well. You could try that as well. Okay, so if you didn't get your question answered today, I apologize. I tried my best to answer as many as possible. I continue to, interact on the social media platforms, my team behind the scenes. So if you see an answer coming through from Team Doctor Janine, check that out, and they will be able to hopefully, answer your questions. And it was so great to have you all here today. A lot of new people tuned in today, so thank you for everybody who followed and who subscribed to my channel. Great to have you here. And we will be having a bit of a hiatus for the next little bit. The next planned show is July 8th. I could be back earlier, but the next planned show for the Doctor Janine Show will be Tuesday, July the 8th. Remember, at 11 a.m. for the Doctor Janine Show, 11 a.m. Eastern Standard Time. So mark that in your calendar. We will be back, but of course we're uploading new videos every single day, so check out my content, and I appreciate, all of the great feedback that I get from all of you. Have a great month or so, everyone. I love you all. Take care of yourselves. Get some natural sunshine, of course, and be well. I'll see you then. Bye.